Hello everyone, welcome back to this channel. In today's video, I will discuss some of the MCQs that might come in the exam. The first question is, a defect in which the urethral opening is located behind the glans penis or anywhere along the ventral surface of the penile shaft is called option A, phimosis, option B, epispadias, option C, hypospadias, option D, cryptorchidism. Here the option A, what is option A? Option A is written phimosis. What is phimosis? Phimosis is the narrowing of the opening of the foreskin. Narrowing of the opening of foreskin is called phimosis. What is epispadias? Epispadias is when the urethral opening is on the top of the penis or called dorsal aspect of the penis. When the urethral opening is on the dorsal aspect of the penis is called epispadias, whereas the hypospadias when the opening is on the ventral part of the penis is called hypospadias. And what is cryptorchidism? It is the condition in which one or both of the testicles fail to descend into the scrotal sac is called cryptorchidism. So here the correct answer to this question is hypospadias, option C. Question number 2. Nissen fundoplication is a surgical procedure for option A, Hirschsprung's disease, option B, tracheoesophageal fistula, option C, gastroesophageal reflux disease, option D, biliary disease. Correct option here is option C, which is gastroesophageal reflux disease, and it is also called GERD in short. So what they did in this surgical procedure, suppose this is the esophagus and this is our stomach. This is our stomach and this is the fundus of the stomach. And here we have the splinter, which is called lower esophageal splinter. And in case of GERD, what happened? Sometimes this esophageal splinter became loose or weakened, or sometimes it keeps opening. So whatever the gastric content we have here, it reflux into the esophagus. So in order to treat that problem, what they did surgically, they wrap this fundus around this esophagus to tighten the esophageal splinter. Question number 3. The paralysis of lower parts of the body is known as option A, hemiplegia, option B, quadriplegia, option C, hemiparesis, option D, paraplegia. Hemiplegia, what is hemiplegia? It is the paralysis of one side of the body. Paralysis of one side of the body is called hemiplegia. Paraplegia is when there is paralysis of all the four limbs. Both upper and lower limbs is called quadriplegia. Hemiparesis is when there is muscle weakness or partial paralysis of one side of the body. Muscle weakness or partial paralysis of one side of the body is called hemiparesis, whereas paraplegia is paralysis of lower limbs or lower body parts. Lower limbs or lower body parts of the body, paralysis of lower limbs or lower body parts of body is called paraplegia. So the correct answer here is option D, which is paraplegia. Question number 4. Indomethacin is an example of option A, aminoglycosides, option B, antiemetics, option C, bronchodilators, option D, NSAIDs. Option A is given, aminoglycosides. What are they? They are the antibiotics derived from actinomycetes. They are derived from actinomycetes, and these antibiotics, they act on both gram-positive and gram-negative bacteria by inhibiting protein synthesis. Examples of these are amikacin, gentamicin, streptomycin, etc. And then option B given antiemetics, option C bronchodilators. Bronchodilators are like salbutamol, salmeterol, etc. And NSAIDs, what are NSAIDs? They are like group of drugs which used to treat fever or pain and some other inflammatory process. And these NSAIDs, they are classified as non-selective, selective, and the COX-2 selective NSAIDs. Example of these are like ibuprofen, indomethacin, then naproxen, etc. So here indomethacin is the example of NSAIDs, which is option D. So the correct option here is option D. Question number 5. The largest sesamoid bone in the body is called option A patella, option B tibia, option C femur, option D fibula. So the correct option here is option A, which is patella. Patella is the type of bone called sesamoid bone, whereas these three, they fall under the category of long bones. The bones are classified into long bone, short, flat, sesamoid, and irregular bones. Example of long bones are like already written here: fibula, femur, tibia. Whereas short bones are like trapezoid, calcaneus, etc. Then flat like sternum, then ribs. Sesamoid bone like patella, and then carpal's bone. Whereas irregular bones are like or vertebra, etc.